Today, we are announcing 79,176 cases and 6,170 total deaths due to COVID-19 in Michigan. Overall, for the past 2 weeks, we've seen a plateau in the number of daily new cases. We continue, as the governor said, to see low levels of deaths, and hospitalization rates remain steady. These are both very good signs. The rate of new cases, however, continues to vary by region. The Detroit, Grand Rapids, and Saginaw regions all have a little over 40 cases per million people per day. The good news is that the Grand Rapids region has seen a 2-week steady decline in the rate of new cases, and today we will be able to move them out of the high-risk category. The Kalamazoo and Lansing regions have over 30 cases per million people per day, but they have seen a recent decrease in cases as well. The Jackson region has just under 30 cases per million people per day, although this area has actually seen a continued slow increase in the case rate for the past 6 weeks. The Upper Peninsula and Traverse City areas are seeing under 20 cases per million people per day as well. So each region of the state, also, this is good news, is now meeting the goal for testing in their region, which is a good sign. Combined, over the past week, we've tested an average of 27,000 people per day, and that's 5,000 more people than the previous week. However, we continue to see the percent of tests done that are positive slowly creeping up, and last week that was about 3.7%, up from 3.6% the previous week. As I've said before, 3% is the cutoff that many experts say you want to be under to know that you're not having community spread of disease. And while we're not as high as some other states across the country are that are seeing a significant surge, this is something that we definitely want to continue to monitor. When there's increased testing and the percent of tests that are positive goes up, it indicates that there may be community spread going on. I also want to spend a little time talking about what we are seeing with outbreaks across the state. So last week alone, there were 78 new outbreaks identified by our local health departments. And I'm going to break those down for you. 31% of those outbreaks were associated with nursing homes or other adult care facilities. 22% of those were associated with social gatherings. 10% were associated with workplaces, and another 9% were associated with restaurants. Other places where we are finding outbreaks include childcare, agricultural work settings, bars, personal care services, and gyms. And there are still times, and this is important, when the local health department is unable to identify where a person may have gotten the disease from. Local health departments last week were able to identify a source of infection for about 32% of the new cases that occurred, meaning we don't know where about 68% of cases were exposed. This means it continues to be incredibly important for people to do the basics. Wear your mask, wash your hands, and maintain 6 feet of distance away from others as much as possible. There's still many new outbreaks that we're identifying every week, and there's evidence that there is spread in the community. And we also know that people can spread the disease even when they do not have any symptoms. I also want to continue to emphasize that you must make sure that you're getting tested. Anyone who's working outside of the house, anyone who's been exposed or has symptoms of COVID-19 should get a test. And you can still go to our website, www.michigan.gov/coronavirus test, or you can call 211 and they can help you find a testing site as well. We've also talked a lot about case investigation and contact tracing. So once the state receives a positive test result, state and local public health staff are reaching out to about 90% of those people who tested positive within 48 hours. However, we're still only able to complete that initial interview of those positive cases about 2/3 of the time, mostly due to people having wrong contact information or not answering the phone. Our preliminary data is also showing us that about 1/3 of people who test positive are already in quarantine at the time that we contact them. This is an important metric that we will continue to monitor. The more people know that they've been exposed and are in quarantine before they have a positive test result, the more we will be able to box in the disease. This is why contact tracing work is so very important. However, as I mentioned, we're still having challenges with people not answering the phone, wrong contact information that were received at the time they got the test, and people not wanting to give us information about their close contacts. So MDHHS is actively working to build out the infrastructure to be able to support this active work. As part of that, we've actually given our local health departments $10 million to hire additional people to do this contact tracing work. And yesterday, we announced a new text messaging platform. Our public health staff will now be able to easily send you a text message to your phone if you were potentially exposed and you can be expecting a call. The most important thing we need everyone to do is answer their phone when public health staff attempt to call you. And I know that sometimes people do not pick up their phone if they see a number that they don't recognize, but this additional text messaging platform will allow you to know that there's a call that will be coming from a public health staff. I want to continue to emphasize, we won't ask for any bank information or social security numbers, but please do share information about who you may have been in contact with. So I know 2020 has been an incredibly challenging year for everyone, but if we are patient, if we do what we are supposed to do, we can beat this disease. That means that if you are sick, get a test and stay home. If you've been exposed, get a test and stay home. Wear a mask at all times if you're going to be out in public. Maintain 6 feet of space between yourself and others as much as possible. Wash your hands frequently and answer the phone if a public health staff person calls you. These simple measures will slow the spread of the disease and they will save lives.